my name is Alexis Pruden, and today I will be doing wound care on Mrs. Smith. So first I would come in, apply privacy, wash my hands, and state to the patient what I'm going to be doing today. So first I went over the doctor's orders for the wound care, and I'm going to explain to Miss Smith what we'll be doing. And I'm going to raise the bed. I'm going to get my patient to state her name and date of birth, and I'm going to make sure that what she says lines up with her wristband, and it does. So Ms. Smith, today we're going to be doing wound care. Is this a good time? She says this is a good time to do her wound care. I'm going to ask my patient if she's in any pain. Are you in any pain? She says no, she does not have any pain. But if she were to have pain, I would give her medication 15 to 30 minutes before I start the procedure.
Let the patient know what I'm going to be doing. Check and make sure the patient is
Okay, I'm going to apply some gloves and do hand hygiene before I do. Okay, I'm going to inspect the area of the wound, and I'm going to try to keep Miss Smith covered as much as possible. Okay, so I don't see any redness around the dressing, but whenever I get her turned over, so it'll be closer to me, so the wound can drain over into the emesis basin, I'm going to get her to turn my way. Miss Smith, we're going to turn my way, okay? Now that I have my patient moved, I am going to start taking off the bandage, working my way to the midline of the wound, and being very gentle. Okay, so I'm going to keep my bandage like this, and I'm going to put my bag on the bed. And now, since I'm working from clean or dirty to clean, I'm going to take off my gloves, perform hand hygiene, and put on my other gloves. Okay, so now I'm going to place my emesis basin below the wound and place an absorbent pad under it, making sure that I don't get Miss Smith's bed wet. So now I'm just going to examine the wound. I don't see really any redness or anything like that, but if I did, I would make sure to document that. So I'm going to get my solution, and I'm going to flip my solution. It has been opened, and I have verified that it's still in date. So now I am going to get some of my solution out and pour it over the wound. Okay. And now I don't see that the doctor has packed anything in, but if it were packed, I would go hand over hand to get the packing out. So now I'm just going to pat my wound dry. Okay. And my doctor has told me that he would like the wound to be packed. You can probably do this with your finger. Okay. Discard of that. Now I am going to get my bandage. First, you would normally, if I were to have a ruler or anything, I would have measured the wound and documented the width and the length of it. And now I'm not going to press too hard on her skin. I'm just going to kind of let the tape fall. I'm going to ask Miss Smith if she feels okay. Miss Smith, does that bandage feel okay? She said yes. And then I would take off my gloves, wash my hands, and then I would put my initials and the date and time that I changed her bandage. So now I'm going to get her to roll back over. Miss Smith, we're going to turn back over, okay? I'm going to ask my patient if she needs anything. Miss Smith, do you need anything before I leave? She says no, not at this moment. So I'm going to place her call light within reach, and I'm going to make sure that any personal items that she would like to be by her bedside would be there by the time I leave. So I'm putting the bed in the lowest position. I'm going to make sure that it is locked. I'm going to document and perform hand hygiene.